When we look at PCOS, it's not just a gynecological condition because we know it has ramifications beyond the reproductive organs, insulin resistance, metabolic disruption, hormone disruption as well.
As we know, PCOS, like you mentioned, has this huge metabolic component and connection to a higher risk of so many other different diseases and conditions. We get offered birth control, metformin, or we're told to come back when we want to get pregnant. The fourth one is we're told to just, work on weight loss. It can really feel dismissive. And I love working in this space because I really feel like there's so much more to learn about this condition and so much more that we can understand in order for women to feel heard.
Cory, thank you so much for joining me. And, I really wanted to talk about this condition on this episode and with you as well, because throughout this podcast, we've spoken about chronic gynecological issues, women's health issues in multiple episodes, ranging from fibroids to endometriosis, adenomyosis. And a lot of these conditions can have such a huge impact on a woman's life. And they're not as rare as you might think. Something like endometriosis happens in at least 10% of women. And the topic of today, PCOS, polycystic ovary syndrome, also happens in at least 10% of women as well, and potentially even more. The incidence could be higher as well. And you have a very personal relationship with this condition as well because you have it and you talk about it a lot on social media. Could you explain to someone listening what PCOS is, and then maybe talk us through your story a little bit as well?
Absolutely. Yeah. And thank you for having me. I love that we're talking more about this condition. It really needs it. So PCOS stands for polycystic ovary syndrome. And basically, in order to get diagnosed, you have to meet 2 out of 3 criteria. And this is where it gets a little tricky because this is where it can really manifest so differently in all of us. So if you meet 2 out of 3, the 3 criteria are, the first one is you have irregular periods. So what does that mean? Your periods are coming on an unpredictable schedule, or they're missing, or you feel like you're kind of bleeding all the time, randomly, haphazardly. You never really know when it's coming or why. So that's the first one. And the second one is to have polycystic ovaries. And the way that you would know that is you get an ultrasound done at your doctor's office. It looks like a little string of pearls. And this is another confusing part because those cysts are different than the true ovarian cysts, the ones that can, get really large and burst and cause pain. These are really a collection of immature, underdeveloped follicles. And the way that I describe it is they're kind of all competing to ovulate and nobody's winning. So they kind of collect on the ovaries. So that's the second one.
These can't actually release eggs. Those immature or those follicles that are there in PCOS, they can't release eggs.
They're correct. They're not releasing eggs. Yes. And so that's where we can see that irregular period happening when someone's not ovulating on a consistent schedule. Yeah. And then the third one is to have elevated androgens. And androgens are our air quotes male sex hormones. And that can manifest in things like acne or facial hair growth, body hair growth we see quite frequently, hair loss on the head, and it can contribute to other symptoms like irregular periods and weight gain. So if somebody has only 2 out of 3 of those, they could have a PCOS diagnosis. And that's why someone with a totally regular period might think, well, I'm growing facial hair, but my period's regular. I don't think that's for me. So, you really have to dive in deep and figure out, is this, a diagnosis that someone is potentially living with? And so, then my personal connection is I have PCOS. And I knew from a very young age, once puberty hit, that something was different, something was off. I never knew when my period was going to come. It was totally random. I had a lot of mood swings and fatigue and hair loss and a lot of weight gain. So, I started to try and understand why that was happening. And I kind of heard about PCOS. I thought, maybe that's me. I didn't get formally diagnosed till later, but I kind of knew that I had it. And once I became a dietitian, I understood there's a huge connection between insulin resistance and blood sugar and how PCOS is showing up symptom-wise. So I thought, you know what? Here I am, a dietitian, and here I know all about blood sugar regulation, right? We learn a ton of that in school here. I'm located in the US. So I thought, okay, well, maybe I am sort of the perfect person to step into this space and start to actually, work to help women treat their PCOS on the other side, right? So not necessarily birth control, metformin, those totally have their place. But, kind of more on the dietary and lifestyle side of things. So that's where I work now.
It's really interesting that you mention how insulin resistance, or the fact that, some people, their cells may not respond to that hormone, which helps us to regulate our glucose levels as effectively. And we often associate insulin resistance with obesity and other metabolic diseases.
Right.
But, in fact, a lot of people with PCOS may be very lean and still
Mm-hmm.
have insulin resistance and
Yes.
may even be asymptomatic. You mentioned those three sort of criteria, two of those three criteria, which someone with
Mm-hmm.
PCOS may require. They may have irregular periods and may have those follicles, those immature follicles on an ultrasound, but they may not ever get round to having an ultrasound, just having irregular periods. We also see so many other causes for irregular periods. So, if a woman is doing a lot of athletic work, a lot of activity, or cutting down calories, or experiencing a lot of stress, all of which are very common these days, they
Yes.
also, for those reasons, may experience, irregular periods or oligomenorrhea.
Uh-huh.
And then they may never actually come to this diagnosis because they've only ever got one of those three. They've never got the ultrasound scan. They may even be harboring that insulin resistance as well. And all of this may be sort of asymptomatic, but actually insidiously, this increases a person's risk of heart
Yes. Thank you.
disease and all sorts of things, metabolic disease later on.
Yep. Yep. Exactly. Yeah. There's a huge connection between insulin resistance and so many things: cholesterol, blood pressure, elevated liver enzymes, non alcoholic fatty liver disease. There's so many things that sort of, we really need to pay attention to if someone is experiencing any type of symptom or is just, complaining about some of those more vague symptoms like cravings and fatigue. Those can all go back to insulin resistance. And for a lot of us, I think that the statistic that I heard most recently and read was 70 to 80% of us have some sort of insulin resistance and are overweight or clinically obese. So that's not everyone. So, it's just kind of tricky and trying to understand, who fits into what category and what can we do to treat that individual, because it is so individualized.
When you were navigating the healthcare system, when you were trying to get a diagnosis for PCOS, and hopefully, and maybe this will be very, very relatable for other people as well, we're probably not very good at confirming the diagnosis of a lot of these women's health conditions. And I guess PCOS may come under this bracket as well, just because
Mm.
of how different it can present in so many different people and the fact that it can go asymptomatic as well for many people.
Right.
So were there any problems that you faced when you were trying to get diagnosed? And then it almost seems that if you compare PCOS to other women's health conditions, let's take fibroids, for example, a core part of fibroids is physical compression of other organs. So it can
Mhm.
cause pain and bloating and all those things.
Right.
PCOS on its own may cause all sorts of other things, but maybe the sort of core symptoms may not include things like pain. So it almost feels like it could be even more easy to dismiss it as not an acute or major issue because of those lack of, pain and other maybe pelvic or GI symptoms.
Yes, absolutely. Yeah, there's exactly. It depends on the symptom, but something like hair loss for women, it can be devastating. So to go to your doctor complaining about hair loss and it's just kind of like, oh, let's, maybe we'll check your iron and you're fine. Oh, well, okay, like you must be stressed. Here's a, antidepressant or something like that. It can really feel dismissive. And I love working in this space because I really feel like there's so much more to learn about this condition and so much more that we can understand in order for women to feel heard and seen in a medical setting. I talk a lot about that on my page. I'm sure you know, but it's common for us to go to the doctor seeking some sort of help for whatever PCOS symptom we're experiencing. And it's really the top three things that I hear and that I've experienced too, but I'm mostly basing this on, the thousands and thousands and thousands of women that I've worked with PCOS, not just my own experience. But we get offered birth control, metformin. or we're told to come back when we want to get pregnant. Actually, and the fourth one is we're told to just, work on weight loss. But there's no, real clear direction in that weight loss suggestion. It doesn't really go further than that. So, that can not always be super helpful. And then the birth control, the metformin piece, like I said, those can be great. Those can be an amazing tool, but not everybody wants to take them. So, okay, what do we do then? And then the pregnancy thing, it's not all of us want to have children, or not all of us will go on to have children. So yeah, there's a lot left to I think there's a lot to be desired there in helping to understand and treat these women who are presenting with symptoms, even if they might not be life threatening. As we know, PCOS, like you mentioned, has this huge metabolic component and connection to a higher risk of so many other different diseases and conditions. So it is important to treat, even if it's something as trivial as hair loss. That person could go on to experience, prediabetes, type 2 diabetes, and a whole other host of complications. Whereas if that hair loss would have been taken seriously and really, that doctor would have been able to dive in deeper and really treat what was going on at the root cause, they could have potentially avoided all of those complications.
I guess, yeah, there's maybe this inherent focus on those buckets, like, the sort of the fertility aspect, or, all those other things, and then maybe ignoring those hidden symptoms like the metabolic disease. And when we look at PCOS, it's not just a gynecological condition, because we know it has ramifications beyond the reproductive organs. In fact, it doesn't really have maybe as major an impact on the reproductive organs as it does on systemic inflammation through insulin resistance, metabolic disruption, hormone disruption as well. And one of the phrases that I don't particularly like, because of how it's been abused online, is the word hormonal imbalance or hormonal disruption. However, in PCOS, there is hormonal disruption. And, there is elevated androgen levels, and there's, there's a whole dizzy of hormones being there at the wrong time, or elevated, inappropriately. And I guess there's so many different factors which play in. And that's where I really wanted to sort of tackle some of those, different facets. One of my sort of passions is talking about gut health. And increasingly, I've seen more and more data coming out linking a lot of women's health conditions, and even PCOS, to disruptions in gut health. Can you talk a little bit more about what the link is between gut health and PCOS?
Sure, yeah. So gut health and hormone health are intricately connected. And, like you said, there's more and more research coming out about how different types of bacteria can in our gut, in our microbiome, can influence things like our weight, our mood, how our hormones are functioning. So there's a lot out there, but that's why I do gut health testing in my practice, because it is really important to see, is somebody experiencing something that they may think is completely unrelated. And yet we do work inside of the microbiome. We help to eliminate some of those, opportunistic pathogens and opportunistic bacteria. And we work to replenish the gut with healthy, normal commensal bacteria. And it can make a huge difference.
I think a lot of people maybe don't even appreciate that if you actually dive into the microbiome, this whole huge colony of microbes that we have, there's actually almost like this subset, the estrobolome, the sort of specific bacteria which deal with the metabolism of estrogen and progesterone and are involved in maintaining that equilibrium. So it's almost, if you don't take care of your guts, the consequence is a disruption of the metabolism of hormones. So we see a lot of these women's health conditions which are estrogen driven, so endometriosis, even PCOS to some degree as well. If you have a disrupted gut, we can't maybe say that that is the causative factor, but that could influence the symptoms to a significant degree.
Absolutely. And so many of us don't even know about that. They don't know that the connection between estrogen specifically and the gut.
So obviously we know a lot of the gut microbiome is influenced by what we eat in our diet. What would you tell your patients with PCOS what they can do in terms of simplifying their diet, or at least adhering to some core basics that they should include in their diet in terms of at least alleviating symptoms of PCOS and just generally improving their overall metabolic risk profile with this condition?
Good question. I feel like I could talk for 18 episodes on this one question, so I'll try to drill it down. I love that you talk a lot about fiber. There's a lot of talk about protein, which is great. Like we need protein is great. Protein helps to regulate blood sugar. But when we're talking about diet for PCOS, we're really talking about keeping blood sugar healthy. What does that mean? Making sure that you're eating enough protein, but also enough fiber. I don't know about where you are, but typically, like the average American woman gets about 10 grams of fiber a day. I'm
Wow.
having my clients meet 35 grams a day and upwards of that. So, fiber helps to regulate blood sugar. Fiber helps slow the absorption of glucose into the bloodstream. So, I think that's a major one that we're missing, and the standard American diet, or the SAD that we call it, it is SAD, just really doesn't include enough fiber. So there's that, and we mentioned the anti-inflammatory piece too, or we'll talk about it here, which is really important too. But I want to give a few pointers on, okay, how do I keep my blood sugar healthier? What are some actual things that I can do to make sure that my blood sugar is healthy? So, one of the most common things that I see is clients going all day without really eating and then eating a large meal at the end of the day because they are busy, they're rushing through work, they've got kids, whatever it is, and then they're eating at the very end of the day. So, my recommendation is to instead eat more consistently throughout the day. So try to get a breakfast in. And if you're like, I don't eat breakfast, I don't wake up hungry, it makes me nauseous. I totally hear that. Try to pare down the last meal that you had the night before. The goal is to wake up hungry. And the more that you do it, you're going to train your body to expect breakfast. That's going to set your blood sugar off on the right foot as long as it's got a lot of protein, it's got a lot of fiber. Typically recommend 20 to 30 grams of protein in the morning for your breakfast and at least 6 to 8 grams of fiber, just to kind of help you fast track to that fiber goal. And then eat more consistently. Try to get a luncheon. Try to get a protein-rich snack in. Don't go all day without eating and drinking coffee and then getting to the very end of your day and just eating, anything and everything in sight, because obviously you're hungry. That's just the way that we work. Another piece to this too, when it comes to diet, is the anti-inflammatory piece. We are eating more, everyone has their own opinion on this term, but air quotes, processed and ultra processed foods than ever. We're busy. We're doing more Uber Eats or DoorDash, meal delivery, food delivery, convenient food, fast food. We're doing more of that than ever. And I always recommend trying to cook a little bit more at home yourself. You're going to be, even if you're not a chef, or you don't need to make anything fancy or complex or anything crazy, but trying to cook more and just learn some basic cooking skills, how to scramble eggs, how to roast vegetables, how to cook chicken, how to cook fish will take you so far in being more in control of what you're eating. It's those more, getting in more of those whole foods versus those processed, ultra processed foods that can really help to get your calorie load, sugar load, fat, salt, all those things, all of those levels down, and introduce more anti-inflammatory foods in their whole food forms. So fruits, vegetables, beans, lentils. So many of us don't eat beans. I talked to so many women who are like, I don't remember the last time I had beans, or I heard they were bad for me because I did Whole30 or something like that. Beans and lentils are great, fiber rich. They have some protein too, lots of antioxidants, vitamins, minerals, nuts and seeds, fish, seafood. Another one I see women chronically under eating is seafood. So healthy, so many omega-3 fatty acids, depending on the type, but trying to get more of that in. So anti-inflammatory nutrition sounds really complex and like this big, question mark, but it really just comes down to eating more foods in their whole forms versus packaged and, out and about.
Yeah, I mean, I certainly have my own opinions about the old ultra processed debate. And ultimately, it just comes down to, I think, most of those ultra processed foods aren't really satiating, and they're often fiber deplete, sometimes pretty protein deplete as well. Or if they do have protein,
Mhm.
it's a lot of synthetic protein added on, which
Right.
isn't necessarily a bad thing. I mean,
Right.
whey protein, for example, or protein
Yeah.
supplements can be very useful. But yeah, it's so just not satiating. So you tend to overconsume, and, over a long period of time, overconsumption can worsen that burden of insulin resistance, which many people with PCOS may already have. And I guess when you talk about anti-inflammatory foods or anti-inflammatory diet, it is simply just at the core of it, one component of that anti-inflammatory diet is fiber, because
Yep.
fiber is fermented by bacteria, and the
Yes.
bacteria poop out anti-inflammatory compounds. And
Yes.
you mentioned fish as well, and
Yeah.
omega-3s are anti-inflammatory by nature.
Another thing you mentioned with, the ultra processed foods is that a lot of these foods, I this might come to a shock to some people listening to this, but a lot of those foods are engineered to be addictive. And I'm going to use that word because they really, I worked in so many different food labs, and in grad school, I was working in there. And there are people, there are people working in these labs who literally they grade something like a chip, and they grade the crispiness, how crisp it is, how much it cracks when you crack it in half, it snaps. They grade that, and then they figure out how to make it so that it's just craveable. Like you can't stop eating them. And that's the goal, right? Because that gets them more business. So it really is incredible to think about some of the foods that we eat. Like I'm going to pick on something like Doritos here. They really are engineered that way. So without even knowing it, we can't stop eating a lot of these foods. And those are totally nutrient, they're just nutrient deserts basically. So a lot of us are eating those types of foods, and maybe if we know that they're not the best for us, we don't realize how much our body just starts to expect them and crave them and think about them. So it's kind of our food environment too has changed so much, and it all plays into this big insulin resistance issue that a lot of us are having.
Another thing, which I guess is very underrated, but also a huge component of PCOS, because we maybe should think about PCOS as a metabolic endocrine disorder as well as just being a women's health condition where we sort of take it full body, right? And I guess one of the things which contributes to this hormonal imbalance is something called the hypothalamo-pituitary axis, where,
Hmm.
the brain, the pituitary gland, is involved in releasing or not releasing certain things. And
Yes.
one big contributor to that is stress hormones and stress, whether it's environmental stress or internal stress that we build up. Your state of mind can also have a huge role to play in PCOS, right?
Yeah, so we've got the two things that come to mind that maybe listeners will resonate with are cortisol. That's being talked about a lot now. Cortisol is our body's stress hormone. It's not all bad though. We need some cortisol, but when we've got an overproduction of cortisol, it can help to slow down the metabolism. It can obviously interfere with sleep, all kinds of things. Blood sugar regulation can also drive elevated cortisol, and then we've got DHEA, DHEAS, and that is an adrenal. It's actually an androgen, but it's produced mostly by our adrenal glands. So we can see stress alone contributing to some of those androgen like symptoms, which is really confusing to some people because they're like, well, I don't have elevated testosterone, but here I am experiencing something like acne and hair loss, and I just can't get to the root cause of it. What's going on? So, yeah, so those things can drive some of those hormonal symptoms. So obviously, we live in just again going back to culture now is just we're so busy. We kind of pride ourselves on being busy and being stressed out. So a lot of that just plays into hormonal dysfunction overall and can influence sleep and mood and weight and libido and self confidence, and it's just a whole cascade of things. One of the best things that you can do though to improve stress levels and your adrenal health is exercise. I always
Mm.
say that if you were to bottle up like a 2-hour sweat session into a pill, it would be a very strong anti-anxiety and antidepressant medication. Exercise is so great for much more than physical health. We always think of it in that context, but it's so important for mental health. So if that's something that, you're like, well, I don't really have an exercise routine. You don't need to go become an Olympic athlete. That's not what it's about. It's really finding a consistent form of movement that you're able to get in on a semi-regular basis. Humans are meant to move. We are indoors now more than ever. We are more sedentary than ever. We used to walk to places, to shops, to restaurants. We do none of that anymore, at least here where I live. So just trying to get in some form of movement that feels good for you is going to do wonders for your mental health, your metabolic health, and your PCOS if that's you.
If you look at the literature, it seems that if for a lot of women's health conditions, whether it's painful periods
Yeah.
or endometriosis, various other things as well, there seems to be certain supplements or at least certain minerals when a woman is then replete rather than deficient in a certain thing like vitamin D, zinc, magnesium, omega-3, it seems to also correlate with a reduction in certain symptoms like less painful periods, less pelvic pain, improved mood sometimes. Is there similar data, or at least from your clinical experience with dealing with these patients, do you also find that sometimes supplementing with specific things can actually influence that disease process as well in PCOS?
Absolutely, yes. Supplements can be game changers. I think the biggest misstep though is when we reach for a supplement before we do anything else and we wonder, why our miracle's not happening over here. We have to
Mm.
also work on the dietary and the lifestyle component of PCOS, but supplements added to that. Supplements are meant to be supportive, can be so super helpful. Women with PCOS are chronically deficient in vitamin D. And vitamin D deficiency is correlated with mood issues like depression, even hair loss, and also irregular periods.
Yeah.
So, vitamin D is something that I always recommend women with PCOS get tested for. And I see it low all the time, more often than not. So, sunlight can be great for that, harder in the winter months, obviously. Fatty fish and egg yolk are great sources. And supplementing, especially if you don't eat a lot of those foods or you live somewhere where it's dark a lot of the time. We have cloud where I live in Oregon, it's cloudy a lot. So I'm definitely someone who supplements with vitamin D. So that can be a huge one. I always recommend to try to get there's a whole host of labs I recommend getting done, but inositol can be a really great supplement as well.
Oh, yeah, I heard
Inositol,
about this. Yeah.
yeah. Yeah. So we've done lots of cool studies on inositol, kind of comparing inositol to something like metformin. And it can sort of, I'm not going to say it's the alternative, but it can kind of exert metformin like effects in the body where it helps to
Wow.
stabilize and regulate blood sugar and really helps women who are kind of along that insulin resistance pre-diabetic track. So if that's you, or if that's someone that I'm, looking at sort of their overall, clinical profile, I typically will recommend inositol. There's two forms, there's Myo and D-Chiro. And research has found that the ratio of 40-1, so Myo to D-Chiro, is really effective, the most effective than either one alone at helping with something like blood sugar. It's also great for egg quality and even androgen levels. So inositol is one of probably the most well-known PCOS supplement out there. And it's wonderful. So that's a really good one. Omega-3s, great for
Yeah.
inflammation. We know women with PCOS have higher inflammatory markers in the blood, like CRP. So omega-3 fatty acids, turmeric, those are great supplements to get started on too if you have PCOS. There's a ton of other ones, but
You mentioned that sometimes you should consider getting these lab tests done. And not only can that help to pick out maybe some deficiencies, but also looking at the hormone profile. Is there like a core list of things that someone should be looking out for with PCOS that can actually help to determine what interventions may be appropriate?
absolutely. Yeah, I have a whole list. I talk about this a lot because I try to have women advocate for themselves to get labs run. And there's a lot of pushback or, insurance won't do this or that. But I would say, try and go for it still, because then we know, right? Then we know if someone is experiencing something like facial hair or acne, they have high testosterone. Great. Now we know how we can work to treat that. We can try to work to bring that testosterone level down, and we can do that. So it's really powerful and important to see what your labs are looking like. I try to recommend to get them once a year if you can. So full hormone panel that would include something like
Yeah.
estrogen, testosterone, progesterone. I want to say this though about progesterone. Many of us, I would say most of us, not all of us though, have irregular periods. So if your doctor recommends getting your 21-day progesterone check, that's likely, every day I get messages and emails, well, my progesterone's low. Well, when did they test it? We're testing outside of the right window. So you need to test
Mm.
progesterone roughly 7 to 10 days after confirmed ovulation. And for most of us, that's not going to be cycle day 21. So that's just something to note. But I would try to see where that's at. FSH and LH, that ratio is chronically off with PCOS. You can get that looked at. If you are trying to conceive, I always recommend looking at AMH or anti-Müllerian hormone just to kind of see where we're at that. It's chronically high in PCOS, but if it's low, there might be an issue with egg reserve. So we definitely want to know that.
Oh.
Vitamin D levels, iron levels, because a lot of us have fatigue and hair loss, and that can contribute as well. So if that's low, let's get that up and see if we can work to, alleviate some of that hair loss and fatigue. I like to look at vitamin B12, same thing, energy levels also can be connected to hair loss. So I want to see what's going on there. DHEAS, if you can, that's that adrenal kind of androgen that we can see symptoms happening as a result of. And that really can point to working on stress management together with someone who can guide you.
What about thyroid hormones?
Yes, thank you. Yes,
Yeah,
thyroid hormones,
you'd get
absolutely.
those in as well. Yeah.
Yeah, a lot of the symptoms of PCOS and a thyroid issue overlap. So, fatigue, hair
Mm.
loss, irregular periods are the top three. So, if you can get a full thyroid panel, which looks at other things like thyroid antibodies, that's my preference. But most doctors will typically start at TSH and go from there. So, at least at the very bare minimum, get that TSH or thyroid stimulating hormone checked.
This maybe isn't a supplement, but it's on that topic of things which people can do themselves. And there's been a whole circus about this over the last few years, and that's the topic of GLP-1 agonists and injections like Wegovy and Ozempic for weight loss. And my personal opinion is that they can be very effective adjuncts to lifestyle changes for many people who meet the criteria for taking those drugs. And I still believe they should be heavily supervised by medical
Yes.
professionals, and someone needs lifestyle changes long term to make those work sustainably. I think they're probably a bit too dysregulated right now and a bit too widely available too easily. But I also feel that in that topic, when we talk about the conversation about weight gain, weight loss, specific to PCOS, many people with PCOS who maybe are overweight or have obesity may struggle to lose weight, not simply because they're not exercising enough or anything like that, but
Right.
that actually there's confounding factors and there's factors and obstacles in their path by means of the hormonal factors. Their appetite regulation
Yes,
is
the huge
almost
one.
working against them. It can be hard. There's a lot of food noise there, and that's part of this hormonal disruption, right? So, and for insulin resistance, something like a GLP-1 may be effective in specific cases of PCOS, right?
Yes, absolutely. Absolutely. And I'm right there with you. We have to be doing all of the other supportive things on the other side of the equation to make sure that, if and when this person discontinues this drug, can they maintain, the weight that they've lost and help to kind of continue that momentum. So definitely needs to be there as well. But GLP-1s, I think, can be really great tools, and specifically for what you said, food noise. So many of us deal with, a lot of cravings, a lot of food noise. And, we've seen so many women just say that that went off like a light switch, just like they were all of a sudden free. I've heard that term used, which is very powerful, from some of those thoughts and feelings. And if they're also working to, drive their A1C down, I am so for that.
I guess it's almost like you wouldn't deny someone with type 1 diabetes their insulin. So if someone with PCOS who has insulin resistance at a high risk of metabolic disorder later on, you
Yes,
wouldn't deny them the chance for having something which could help them reduce their risk of metabolic syndrome and metabolic disease, down the
correct.
line if they need it.
Correct. Yep. And I think that there's just a lot of shame around it, shaming because they're newer on the scene, not really, but newer on the scene. I mean, we would never shame someone with depression, trying to take an antidepressant to better their lives, right? So I think there's a lot of conversations around that need to happen and probably will in the next, decade or so around GLP-1 use. But yeah.
And what do you think? I mean, because we previously mentioned that there may be some obstacles in the healthcare profession and in the medical institution with someone getting a diagnosis of PCOS. What are some advocacy steps someone could take and almost take to the doctor and say, this is what I want, and this is what I think is going on? What are those sort of phrases or questions that you could go to your medical professional with, your healthcare provider with?
Yeah, that's a great question. I try to talk a lot about this because some of us just don't really know how to approach the conversation and the topic. So I would come with a list, and sometimes when we're trying, just like right now, if I'm trying to think of a list in my head, my thoughts get all jumbled up and I just can't remember. So write it down. Walk into your appointment with a written down. It sounds like you're just going overboard, but write down all the symptoms that you're experiencing that you think might be tied to something going on hormonal or, PCOS wise or whatever it might be. And then go in with a list of labs that you would like ideally for them to run, understanding that, maybe some of these insurance might give you some pushback. I understand that. And I still want to move forward if that applies. So a list of lab symptoms and, ask them to, outside of birth control, if you're someone who just does not want to take birth control, outside of birth control, doc, what can you recommend for me? Like what else can we do here? Metformin, same thing. So, try to explore alternatives if that's what you want to do. Because there is such a huge connection between blood sugar balance and regulation and something like PCOS, if you can get a referral to a registered dietitian who might have a good understanding of PCOS, all the better, because they can really help guide you on the other side of things in terms of, that blood sugar insulin resistance component. So a lot of doctors and hospitals have good relationships with specific types of dietitians. There's all types of us out there. So if you can find someone who is covered by your insurance, or at least you can work with, that specializes in something like this, amazing.
I mean, in my own experience of working in the healthcare system over many years, I've seen how many women are misdiagnosed with something else instead of their main primary gynecological condition. And I guess there are probably similar things happening with PCOS, because women with PCOS have a increased risk of having irritable bowel syndrome, IBS. They also have an increased risk of things like anxiety and other mental health conditions. So you can see how someone presenting with those non-PCOS, those core symptoms like, absent periods or androgen-related symptoms, or even having an ultrasound and having those sort of polycystic ovaries seen, maybe having
Yeah.
some GI issues or mental health symptoms
Mm.
can be
Hmm.
misdiagnosed. And then they're
Right.
stuck in this sort of vicious cycle where they've been given a wrong diagnosis, or they've been underdiagnosed or misdiagnosed, and they keep having these other symptoms which don't correlate with their false diagnosis.
Right. Yes, exactly. The waters get very muddy. Yeah. Yep. And we can get kind of passed from doctor to doctor to specialist to specialist. Okay, well, no, we're going to send you to an endocrinologist. Oh, no, we're going to send you back to your OBGYN. No, no. So it's just kind of like playing ping pong on, where to go and who's going to treat what symptom that you're experiencing. And ultimately what I've found, it just comes down to the individual. It comes down to the provider, and their own kind of knowledge about the condition. And I've seen some amazing magic happen there. So it really depends on who it is, and just trying to find the provider that is right for you.
What would your advice be to someone who is newly diagnosed with PCOS and finds it also overwhelming?
I think social media can be such a powerful tool in understanding and learning about PCOS, but as it's grown, I mean, I feel like I'm one of the OGs. I think I started my page in like 2018 or something. So
Wow, yeah.
since then, there's just so many people who maybe have PCOS and are well meaning, but have absolutely no clinical background or medical health, not just no knowledge whatsoever. So they're kind of giving out advice that worked for them, which comes with its own whole host of issues, including it's very confusing for someone who's newly diagnosed to navigate. What am I actually supposed to do? What am I actually supposed to eat? So, if you are on social media and you're following people who are giving out PCOS health advice, make sure that they are licensed and credentialed, right? So, they are an MD, an NP, an RD, a registered dietitian. Even an RN would have more, much more knowledge than just, maybe someone who took a 2-hour certification class. So make sure someone has the right background and qualifications to be giving out health advice, because this is a health condition. This is not just like, weight loss. This is a huge deal. So that's one. And I think also just trying to understand when you come across things that diets, like so many people will send me screenshots of like a PCOS challenge, lose 20 pounds in 2 weeks or something crazy. If it sounds too good to be true, it probably is. If you are working on weight management, you're going to want to go slower than that. So be aware of those red flags when it comes to kind of salesy and gimmicky things. Same thing with supplements. That's a huge one.
Mm,
Something that I see all the time now are GLP-1 or supplements, right? Like they're like
yeah,
acts just like a GLP-1. I'm like, nothing will be nothing will be
exactly.
Ozempic except Ozempic and maybe semaglutide and some other ones. But yeah, so supplements are a huge one. You can run them by. You can always, I have people always sending me, screenshots of this or that they see. Supplements that they come across is this legit, and I can take a look at it and let you know my thoughts on it. But run it by a professional who has had years of experience in treating PCOS, because we're going to easily be able to separate fact from fiction. So you can always ask people that have worked here in the space that have the right qualifications if you are stumped about a particular product or service or program or whatever it might be. Coaches and, like I said, all of those things, you just want to make sure that they are licensed and credentialed before you give thousands of dollars to someone to work with them who's promising you the world. And trying to work with someone who can guide you to what's the right diet for me. What am I supposed to eat? How am I supposed to move? What supplements do I take? That's where it really can be helpful to work with someone who specializes in PCOS, because they're going to be able to give you the right advice for your unique PCOS and your unique body, because like we've talked about, it can really manifest so differently in all of us. So it can be a worthwhile investment. And I'm not just saying that because I am an RD. I'm saying that because I've seen, women try to piece together every single thing that they've seen online, and they just end up more confused than ever. So it's worth it to see a specialist and get that guidance for your unique situation and health goals.
Yeah, I think navigating health, particularly with the amounts of information online, can be a bit of a minefield. So thank you for being a voice of reason and
Yeah.
good quality evidence as well, and being one of the OGs giving good information about diet and particularly PCOS, such sort of an under-researched and under-discussed
Yes,
topic. So thank you so much, Cory.
totally. Yeah, absolutely. Thank you. Thank you so much.